OPB Podcasts.
From the Gert Boyle studio, it's OPB Politics Now for Thursday, June 12th. I'll be honest, it can be tough right now to narrow down what exactly to talk about on our show on any given week. We could talk about the legislature and any number of bills, or Portland's new city council's seemingly daily effort to learn how to do its job, or immigration raids and the prospect of major protests in Portland. We probably will end up talking about all those things in coming weeks, but this week we're turning to another major issue in the political world, President Trump's big, beautiful bill and how it could impact Oregon. Welcome to the podcast. I'm OPB Politics Editor Andrew Theen.
I'm OPB Health Reporter Amelia Templeton.
And I'm OPB Politics Reporter Dirk VanderHart.
Amelia, let's start with you. We've been talking in the newsroom in the past month or so about the president's first major priority in Congress, the big, beautiful bill, as he calls it. And the crux of our conversations have really focused on Medicaid. Why has this been top of mind?
Well, the bill's Republican proponents are calling it the single largest reduction in mandatory spending in history. And a big part of that comes from the Medicaid program. That, of course, is health coverage for people with little income or no income, also people with disabilities. And there are also cuts to SNAP, the food stamp program. For the Medicaid program, the bill reduces spending by about $800 billion over 10 years. That's according to the Nonpartisan Congressional Budget Office. The cuts are, in essence, to help offset or pay for the tax cut extensions in the bill. Republicans say if they let those tax cuts expire, it would be ruinous for the economy. One issue that's causing some friction right now, though, as the Senate takes up the bill, is that in spite of these cuts to Medicaid and SNAP, the bill is not deficit neutral. The CBO has estimated that even with the offsets, it would add trillions to the deficit over time.
Okay. That's a lot to digest there. And before we get too far, you mentioned a little bit about what Medicaid is, but can you remind us what is Medicaid? How is it funded? How did it become so vital to Oregon?
It's the program that pays for and provides health care to low-income Oregonians, better known here as the Oregon Health Plan. And Oregon does have a really interesting and unique history with the program. 3 decades ago, facing rising costs, the potential of federal cuts, then Governor John Kitzhaber came up with an interesting proposal for how to basically save money and reduce the growth of spending in the Medicaid program without cutting people from the rolls. The state got permission to try what is basically managed care. The way it works is we pay Medicaid insurers a fixed amount of money per person that they care for, and they have to make choices about how to spend that money that manage people's health care well so that they make a profit. And, the idea is to sort of try to align the incentives around money and healthcare better so that you're not just paying for more care, you're paying for better health. Part of the bargain that Oregon struck with the federal government to do this was that we agreed to have costs in our Medicaid program grow 2% less than in other places. Okay. And in exchange, they give us a lot of flexibility about how to spend the money. So what all that meant was Oregon kind of did Medicaid. Was I saying Medicare?
I believe you said Medicaid.
Oh, good. Part
Two
of
major programs.
Very different.
It can be hard to keep in track,
Yes.
Similar names.
So part of what this meant was that Oregon expanded Medicaid basically before the Affordable Care Act. And then we were really have been all in as many different ways to expand the program and increase the number of people enrolled in it as possible.
You mentioned the Affordable Care Act. Obviously, that's the Obama-led plan that led to this massive expansion of Medicaid to all the states, which is
yes,
kind
to sort
of
of
where we are now.
more, working age adults who are low income, as opposed to just sort of children, the elderly, pregnant women.
Right. All right. Well, thank you for that helpful primer. So you took all this context, Amelia, and turned around and presented it to experts who are tracking, analyzing the big, beautiful bill. And you kind of had this instinct that Oregon would be affected. And it seems like from the people you talk to, it does seem like Oregon's going to be maybe more affected than other states because of that history, right?
Yeah, and particularly when it comes to the number of people who are, or the percent of people who are currently enrolled in the program who could lose coverage. We're not the biggest state in the country, so there's other states, California, Texas, where more people are going to be disenrolled than here. But what's unique about Oregon is really how far we've pushed this effort to enroll as many people as possible and then keep them in the program once they're enrolled. And so, it sort of stands to reason that a state like Oregon that already has the ACA expansion, that has also extended coverage to undocumented immigrants using state funds, that we then stand to see one of the biggest sort of shrinkings of our program from these changes. There are 3 provisions in the bill that experts believe, and I think CBO has found, will reduce enrollment. The first, the most straightforward, is a work requirement. So people have to prove that they're working or seeking work or volunteering at least 80 hours a month in order to keep their coverage. The second provision is more frequent eligibility checks. And that's a provision that kind of sounds boring, but is really poised to be significant for Oregon, and is worth going into for just a minute.
Please do. That's why we're here.
So in most parts of the country, once you're enrolled in Medicaid, you have to go through a process once a year to prove that you still qualify, that your income hasn't gone up so much that you no longer need the benefit, or that you haven't moved out of state. And there are some reasons to do this. One is that it saves states money to remove people from the rolls if they're not eligible. But there are also real costs to doing it. And the first is pretty straightforward. It just takes a lot of time and energy and people to process these eligibility checks. And the second is that people can lose coverage for a lot of different reasons during this process. Maybe they have moved. They didn't get the notice in the mail. Maybe they're not good at returning the required paperwork. Maybe they do gig work and their income has gone up for a little while, but they are still fundamentally in the same, income bracket that they always have been. And that has meant that when you do more frequent eligibility checks, you get this issue of churn, where you have people coming on the program, getting booted off, and then back on within a year. And Oregon has intentionally tried to reduce churn. We want to sort of keep people on as the model here. So currently in Oregon, we're the only place in the country that does eligibility checks for adults once every 2 years, and children can stay enrolled through their 6th birthday. So any child that qualifies at any point in their early years will just stay on without the family needing to prove that they're still eligible. And this bill would change that. This bill would mean that Oregon would have to check everybody's eligibility, adult or child, every 6 months. And that would inevitably mean more churn. It would mean more people who aren't eligible getting removed from the program, which I think is, what proponents of the bill say they're trying to do. It would also, I think, without question, mean more people who are eligible getting removed from the program.
Okay, like you said, the waste, fraud, and abuse component that Republicans have been pretty vocal about, that's their idea of targeting that is through this provision.
Yes, and some other provisions in the bill.
Okay, but meanwhile, if you're a recipient of OHP, it obviously is going to be disruptive to your ability to get care if you're coming on and off the rolls.
Yeah, one state senator likened it to having to file your taxes twice a year.
Okay, thank you for that. That's very interesting. So, Dirk, let's turn to you down in Salem. How is all of this chatter playing in the Capitol, where lawmakers are still meeting every day, trying to finalize a budget, trying to pass major legislation, but obviously it's hard to ignore what's going on in Washington, D.C. and the big, beautiful bill and the discussions of where it's at. So how is that affecting budget talks?
I mean, outwardly, it sort of hasn't been, at least to some huge extent. So, lawmakers and the governor right now have sort of said, we're very worried about this, but we are going to focus on what we know is real, and that is the revenue forecasts that we have in front of us. If congressional Republicans and the president do figure out a way to get this bill across, we are going to cross that bridge then. Actually, just this week, Governor Tina Kotek pretty much said this explicitly in a meeting with reporters.
Right now, I'm focused on fighting with our congressional delegation to keep that from happening. If any or all of those cuts go through and the president signs it, we will have challenges here at the state level to deal with that. And to be very frank, we're just going to see what happens, right? The depth of the cuts could be so big that we would have to have a special session before next year, but it could be months before they even figure out this bill.
And, I'll just be honest, talking to people in the Capitol, I think there is at least in some corners, a very strong belief that a special session is on its way. But, obviously it depends on what happens in D.C. And, Democrats are not just I don't want to give the impression they're ignoring the hole this might create. They're talking obviously a lot about the threats, sort of railing against what congressional Republicans, the president, want to do, that it's going to pose harms to people's health or their ability to get food. And, the state's top budget writers said earlier this year they were really serious about setting money aside to sort of grapple with the possibility of federal cuts. Back then, they said that was around $1 billion they had in mind. Now, that was before a recent revenue forecast we got last month that sort of revised down the state's funding picture. It is not clear right now how much they are looking to set aside at this point. There are still some really live wires when it comes to Oregon's budget. So sort of waiting for the dust to clear a bit before we know what that number might be.
Okay. And meanwhile, I think the administration has said they want the bill to be, on the president's desk by the 4th of July, something to that effect, which is not too far away. I guess we shall see. So this is a politics podcast, obviously. We have one Republican member of Congress, that's Cliff Bentz. He's in the majority. He voted to support the House version of this bill, Amelia, and he's on a very important committee in that chamber. Can you explain how Bentz's public stance on this legislation has been and reflect on what it could mean for his district in particular?
Yes. Bentz not only voted for this bill, but he sits on the specific subcommittee of the House Energy and Commerce Committee that crafted the Medicaid cuts. And he has discussed at least a little bit his role in those negotiations. I would say his public stance. First, he's a very strong proponent for the tax cuts in the bill. I think he's a true believer in the importance of those tax cuts, and I think hopes that they will spur growth, perhaps, in rural parts of Oregon like his district. He treads a very careful line when it comes to the Medicaid portions of the bill. He has described himself, he says essentially Medicaid is an important program, and he emphasizes the fact that the bill does not directly target cuts at the elderly, at pregnant people, at people with disabilities, at some of the most vulnerable populations who are enrolled in Medicaid. He hasn't spoken to me directly in an interview yet. He hasn't held an in-person town hall since February, but he has talked with others about the bill, including on a call with one of OPB's environment reporters yesterday. Here's what he said.
It appears that there'll be about 71,000 able-bodied adults that will choose not to work. And those folks would be taken out of this insurance program. And so they still would have access to 3 or 4 different healthcare safety nets. It's unfortunate that people haven't taken the time to look at the numbers.
So, Bentz essentially, I think, argues that Democratic opponents of this bill are exaggerating its impact. Now, I would say that is not what I'm hearing from healthcare providers in Oregon, including rural providers, in Bentz's district. Hospitals in particular are very concerned. They are already in the state barely breaking even in many parts of the state. They rely on the funding they get from Medicaid, especially in rural areas like Bence's district, to reduce the amount of uninsured, uncompensated care they provide. And they've been very clear that if this bill passes, they expect to have to further cut services in those rural areas.
And to put a finer point on it, your reporting showed his district is one of the most dependent in the nation, right, in terms of Medicaid.
That's right. In Oregon, overall, about 1 in 3 Oregonians is on the Oregon Health Plan, and more than 50% of all kids. In Bence's district, it's about 40% of the population that gets their health care paid for by Medicaid. So thinking through how this bill would impact Bence's district, I think another frame of reference is the Congressional Budget Office's analysis of the wealth transfer in the bill. In response to a request from Democrats, they looked at who essentially wins, who loses. That analysis found that the bottom 10% in the country would see a net loss of income, about 4% of their income a year due to the Medicaid cuts, the SNAP cuts. Meanwhile, the top 10% of earners would see a net increase in their income of about 2%.
Let's stick with Congressman Bence. One thing you've mentioned is he's been really talking quite a bit with John Kitzhaber, the former 4-time governor, Democratic governor of the state. What do you know about the nature of their conversations?
Yes, I've spoken with Kitzhaber about this, and Bence has also brought it up publicly. From what I understand, the two had extensive regular conversations in the months this spring when the bill was being crafted. What Kitzhaber says is that he was encouraging Bence to float a version of the Oregon plan, essentially managed care, tackling medical inflation, to the Republicans on the committee. Kitzhaber also had an op-ed in the Washington Post. He was kind of trying to get this idea out there that there are ways to cut this program that don't require kicking people off. And that Democrats should embrace the need to cut this program, that Medicaid spending has been, essentially growing too quickly, that we can't afford it. Kitzhaber basically told me that he didn't think Bence was able to get any traction with those ideas, and he is deeply disappointed in the bill. Described it as cruel and unethical, and believes that it will simply drive up the uninsured rate in the state of Oregon.
Okay, well, that's fascinating. The conversation between those two. I said we wouldn't be talking about immigration here, but there is a connection that you alluded to earlier in this conversation, Amelia. Oregon currently pays for about 100,000 immigrants to have health care through the Oregon Health Plan. That seems like political catnip for the Trump administration. Yes.
That is, I think, one of the more controversial aspects of Medicaid expansion. If you look at public polling, there is some significant support for the Republican position for not paying for health care for undocumented immigrants. Oregon's program, to be clear, that 100,000 people, that is not 100,000 undocumented people. That includes both people who are here on green cards, who are legal permanent residents, who came through the refugee program, and also undocumented people. The Trump administration and this bill create a very sort of painful choice for states like Oregon that have chosen to use exclusively state funding to provide health care to people regardless of their immigration status. The bill would reduce the federal match rate for some adults in Medicaid if states don't agree to basically withdraw their own state-funded programs. And it's the kind of thing that you can easily imagine states mounting a legal challenge to. There's potentially kind of like a federalism issue here. But if that provision stands, multiple people have told me they don't think Oregon could afford to backfill the billions of dollars of lost federal funding that would happen if that match rate gets reduced.
And that brings us back to some of the budget discussions that Dirk mentioned earlier. Okay, we've spent a lot of time on this bill, but it's very big, as we mentioned, and important. Anything else, Amelia, that I should have asked you on this?
One thing briefly. The bill does not extend larger, more robust tax credits for health insurance plans sold on the individual marketplace, the Obamacare marketplace. So if those tax credits, enhanced tax credits expire, that would mean that at the same time that these other changes are playing out, that premiums for those plans will go up significantly. And that, will make healthcare more expensive for everybody in that marketplace. Premiums already went up 6% this year. And so it would be kind of on top of the existing increases that we're seeing.
Okay. Well, that is even more context to digest. We are going to switch gears here because, Amelia, you obviously cover health issues for OPB. And just last week, a federal judge weighed in on a very long-running and politically charged issue that dates back to the early 2000s. Oregon was found in contempt of a court order that requires people waiting to be swiftly admitted to the state's psychiatric hospital be admitted. Can you explain the backstory, the significance here?
Yes. So currently, the state's psychiatric hospital primarily treats people who have been arrested, charged with a crime, and are too sick, too ill, too debilitated by mental illness to stand trial. And, essentially that means a lot of people with disorders like schizophrenia or certain kinds of bipolar disorder who are experiencing some form of psychosis, hallucination. And what happens to those people in jail is that they struggle to follow orders, interact with other people. They often end up in solitary cells. Some of them struggle to eat and drink. They can end up incredibly debilitated and in some cases have even died before ever standing trial. So because of these conditions, decades ago, Oregon, a judge in Oregon, a federal judge, ruled that the constitutional rights of people with mental illness in jail were being violated, that they needed to be admitted to the Oregon State Hospital within 7 days. Within 7 days of a judge essentially finding that they can't participate in their own trial. That 7 days, it's like a very simple metric. It has been profoundly hard for the state to comply with it. And we've been out of compliance for decades. Trying to get to a point where we can move people in and out of the state hospital that quickly has meant really controversial, thorny changes to how the state hospital operates, like mandatory limits on how long people can stay there. Prosecutors in particular have been really unhappy with that. So, in essence, what happened last week was, in spite of the decades of work that have gone on to try to meet this hard and fast 7-day requirement, the state hasn't gotten there, and a federal judge concluded that that failure amounts to contempt of court, and the state will now be fined $500 a day per person who has waited past that 7-day limit.
Wow. And what has the Oregon Health Authority said in response to this?
They've said very little since the ruling, so it's unclear, I think, if there will be any legal challenge to it or if this is kind of where this ends. But what we do know is what they said in court. The defense that they attempted to mount in court was essentially, we have done everything that we can, and we need more resources from the state legislature. We need... we are trying to build alternatives to the state hospital so that we can move people out and somewhere better and more appropriate. But that takes time. And the court essentially said, you've had time. you haven't tried hard enough. And I think Judge Nelson, may also be sending a message to the legislature here that there will be consequences from the federal courts if changes aren't made.
Yeah, and Judge Nelson is Judge Adrian Nelson, the third judge, I believe, to touch this case. Dirk, what's the political angle here? When something's been dragging on for decades, people are going to be frustrated. And who's frustrated about this in your world, and why are they frustrated?
I mean, I've heard a lot of frustration this week, and that's partly because we haven't talked about it a lot, but there really has been a ongoing and pretty fierce debate about how to handle this aid and assist population. So the folks Amelia is talking about, they under the law are deemed unable to aid and assist in their own defense. That has given them the shorthand of aid and assist population. So if you hear that verbiage, that's what we're talking about. But so, there's a couple things at play, actually a lot of things at play. One is that Governor Kotek and the OHA have had a bill this session that would essentially put some of these timelines Amelia is talking about from the court, that folks need to be treated in the hospital for a certain amount of time. Actually, maybe Amelia didn't touch on this, but the court also has timelines that say, you can only be in the state hospital for a certain amount of time trying to get recompensated in order to stand trial. If you're not, then you have to be let go. There's a bill that would put those timelines firmly into state statute and do some other stuff that has been very hard fought by district attorneys and actually defense attorneys who agree on this and say the timelines that the court is putting into place are not helpful. They're not helping people get to a place they need to be, and they're not good for public safety. So they have been really pushing back on that. That debate is still underway, and a lot of things are underway. And I think a lot of people were pretty surprised that the judge decided that rather than wait until the end of session, which as we speak is 17 days away, she wanted to strike the hammer now. Here's what Kotek said on this week.
It is frustrating to me that we weren't given till the end of session to deal with that. But this is a situation we have, so we're going to do it the best we can. And I would ask legislators and district attorneys and the courts to all work together to make sure we can serve this population the best we can.
And I think part of what she's saying there is a nod to the fact there are some real big disagreements on how to deal with this. But the fact is that bill, those two bills I just mentioned, are not going to be the answer to Oregon's problems. They're about timelines and how we move people through the system. But really, even the most sort of stringent of them would institute a system that, as Amelia said, is not currently working to meet the court's timelines. So what is really going to be fundamental to all this is creating more resources to help people, right? A more robust behavioral health system that can catch people in crisis and to reach them before they get to this point of criminality where they're suddenly in the criminal justice system being sent to the state hospital that way. I mean, like I said, there's a bunch of proposals on this. There's proposals to raise spending, expand resources to more efficiently spend money on behavioral health. And as I think we've talked about in the podcast, to lower the bar to civil commitment so that people can be brought into this system before they reach the level of having a criminal case against them. There's just so much at play. And what people will often say in this discussion is Oregon is going to have to figure it out, or a federal judge is going to make them figure out, and we're going to have to spend our money that way. We're going to lose the opportunity to spend it how we might want. And I think that is the pivot point. That is the line we have crossed now that we have been found in contempt.
And speaking of that fine, I guess, what are those fines that Judge Nelson ordered up? How would they affect the budget?
Yeah, I mean, that was a question I asked the governor and the OHA this week. The early estimates of this are that if Oregon doesn't start doing better via all the vehicles we've just talked about, we could be seeing between $250,000 and $500,000 in fines every month. So that is between $3 million and $6 million a year. Now, the governor says she expects that we're going to be doing better. In fact, she says we are doing better. But really, truly, things need to change. And the other question I had is, okay, if potentially $3 and $6 million are coming off the top. Like, how does that impact our ability to spend on the things we want, right? If we're paying fines into the court. Right now, top budget writers and the governor are saying they don't think this impacts our ability to budget wisely and really achieve some of the things they want to do in the next budget. So I suppose that is good news.
I will say that at least in Washington State, which also faced a contempt ruling for a parallel case to this, the fines, the money that was ultimately collected in fines, then went to some of the solutions, essentially building out the kinds of care facilities for people with mental illness that the court believed were necessary to alleviating the problem.
Okay.
Right. Yeah. This isn't money that's going to just be going into Judge Nelson's pocket, obviously. But I think that the distinction people draw is that, okay, we can either find our own way that we want to handle this, or every dollar we put into this is now subject to what the court wants us to do. And it's just another layer of oversight. And I think in some people's minds, counterproductive oversight.
Well, that's a lot to digest, and it's certainly an interesting wrinkle that happened last Friday that everyone was reading the emails and processing, and thank you both for talking about that and the big, beautiful bill. We'll leave it there for today. This week's episode was produced by Ryan Hass, and our audio engineer is Nalene Silva. Our music comes from Audio Network. In these uncertain times, we are certain that you have questions about local politics. Maybe we can answer them. We would love to hear from you. Email us at opbpoliticsnow@opb.org. We'll be back next week with more political news from across the Pacific Northwest. Until then, you can find all of OPB's reporting at opb.org. Thanks for your support, and thanks for listening.